Sinuj. My name is Sinuj. My pronouns are he, him, and I'm joined by Akansha, who will be co-hosting with me, and she'll take over momentarily. And she'll be assisting me with hosting the session today. To begin with, we would like to take a moment for our time to acknowledge that the University of Alberta Student Union is located in Amiskwasi, Waskahikan, Edmonton, which is situated on Treaty 6 territory. The land is the ancestral space for Papache's Cree, Métis Nation, and traditional territory of Blackfoot, Cree, Dene, Stoney Nakoda, Anishinaabe, and many other Indigenous peoples. We respect the histories, language, cultural practices, and traditions of all Indigenous peoples. And I'll hand it over to Akansha to acknowledge some sustainability things. Akansha, over to you.
Thank you so much, Sanuj. Hello, everyone. My name is Akanksha Yola. I use she, her pronouns, and I work with the Sustainability Council at the University of Alberta. We are so happy to partner with ASLS and Dr. Daniel today on this wonderful event. The Sustainability Council works to serve all faculties at our university by supporting sustainability-related research, teaching, and service across the disciplines, as well as the broader community. During the academic year, the Council hosts interdisciplinary scholars, professionals, and activists who engage with sustainability, climate change, and the environment to showcase sustainability work and to be in dialogue with leaders doing similar work elsewhere around the world. Now, the Sustainability Council also provides students with opportunities like the Certificate in Sustainability, Sustainability Scholars, and various other opportunities. We also have some really exciting events coming up this semester, including our lecture series, the schedule for which will be posted on our website very soon and is constantly being released via newsletters. So to know more about Sustainability Council's events and opportunities, please feel free to browse our website and sign up for our newsletter. I will be adding a link to that at the end of the session, so please feel free to stick around until the end after the Q&A. And if you have any questions, I'll be around to answer any of those as well. I'll pass it back to Sanuj now to introduce our speaker for today, Dr. Daniel.
Before I introduce our guest speaker, I would like to ask everyone, make some housekeeping announcements. Please keep your mics on mute at all times. If you have any questions, please put them down in the chat. And now it's time to introduce a very important person, Mr. Daniel, Dr. Daniel Rainham. He's a professor in health promotion in the School of Health and Human Performance at Dalhousie University. He's a research scientist with the Healthy Population Institute and flagship project co-lead creating sustainable health system in a climate crisis. His research examines associations between the quality of the environment and human health, focused on measuring the characteristics of the environment, investigating how these characteristics affect our health, and experimenting with solutions and interventions towards a sustainable, healthy lifespan. Please welcome Dr. Daniel, and Dr. Daniel, the stage is yours.
Thank you very much, and it's a privilege to be asked to share with you some topics, some information I get excited about. And I also really want to thank the organizers. This is an extremely well organized operation, and it looks like there's a lot of volunteers and people doing a lot of hard work to make this happen. So I want I'm just going to share my screen now. Okay, I'm hoping everybody can see that. Yes, great. Okay, well, enough about me. It's also, I guess, nice. I was just saying earlier that I actually did my master's at University of Alberta. So I spent a couple of years there and really enjoyed my time in Edmonton. So it's good to sort of return back and chat with people from the university. I too live in the ancestral territory of the Mi'kma'ki, the Mi'kmaq people in what they call Mi'kmaqi and more broadly Wabanaki. And this is the ancestral territory of the Mi'kmaq, and it's unceded. So we are slowly working towards reconciliation to ensure that we are sharing the lands, and we're all treaty people here, at least in Nova Scotia. And I just wanted to say that these kinds of acknowledgements, that we can read them to offer recognition and respect, and I think it's important to do that. But there's also a lot of things we can do beyond reading these kinds of acknowledgements. And I think to make it more meaningful, it's really helpful to consider that we are in fact acknowledging not only the ancestral lands, but also that sort of historical and complex intersection of the kinds of impacts we as settlers have had on Indigenous history and economies, and acknowledge the land relationship that they have, their livelihoods and governance structures. And I also think about what my own actions look like in creating strong and healthy communities governed by mutual trust and respect. And I like this word that they have in the Mi'kmaq language called Ndugu Limp, or the Mi'kmaq understanding of sustainability. And what it means, the word means, is actually to celebrate the connection and balance between the natural and human worlds, or to achieve adequate well-being without jeopardizing the integrity, diversity, and productivity of nature, which to me sums up the idea of sustainability quite nicely. So I'm going to move through 4 main areas. I'm going to talk about the Anthropocene. We're going to talk about planetary health, and I'm going to talk about climate change and health, and I'm going to specifically talk about creating sustainable health systems. And I'm going to assume that most people who are interested in sustainability, sustainable development, and so on, probably have some idea about many of the concepts that I'm going to be talking about early on. So I'm not going to spend a lot of time on these, because I'm really more excited to tell you more about what we've been up to in thinking about how can we reduce our impacts associated with the delivery of healthcare and public health. So, you know, many scholars, and it's kind of a recent phenomenon, would talk about the unofficial current geological age that we've entered into as a species, called the Anthropocene. And this is really a time at which we can detect or see that human activity has really been a dominant influence on the planet, including our ability to influence. We can modify and now change the climate, and we can modify very broadly the environments around us. So we have, we're wielding quite a bit of power, and unfortunately that seems also to affect a lot of other species. And really what we're talking about is operating massively and rapidly. So we have, you know, population growth, and we have advanced our technologies to the point at which we are creating rapid global ecological change. And this plot here, just this, you know, this figure here shows you about, you can see almost every single signal we have about human impacts has been rising significantly over the last century, particularly since the Industrial Revolution. And so these different Earth system trends are really a result of human activity. So it's a, you know, the unsustainability issue that we're dealing with is a human social challenge. And, you know, how we typically measure our success as a species, unfortunately, is through looking at something like GDP, or gross domestic product, which has grown over the last 70 years from 9.3 trillion to over 100 trillion now in 2016. And our population has grown. It was about 3.24 billion when I was born, and now I think we're over 8 now. So it's more than doubled, almost tripled in my lifetime. So we're exceedingly good at reproducing. And a lot of this has been enabled by rapid technological advancement as well. So we're putting a lot of pressure on the system, and we're also creating social systems that are rapidly increasing and consuming resources. And if we think about this notion, and some of you may have heard of this idea called the ecological footprint, which is really just trying to assess how much land would be required to sustain our lifestyle. So if you were to do, you know, calculation of how much impact you have on the planet, how much consumption is required to sustain your travel and your eating habits and your housing and so on, we know, or we have some estimation that around the late 60s, early 70s, the human population started to overshoot the capacity of the planet to provide all of those resources. And when that happens, of course, the resources become inequitably distributed. So some of us have more and some have less. But at the end of the day, if we can all agree that we have just one planet to work with, and some would say that we need to expand our horizons further abroad, then we're going to run into trouble. And so this plot, if you index everything to around the time when humans started overshooting the capacity of the planet, we can look at some trends over that time. And one, of course, as I just alluded to earlier, is the idea that, you know, the population's been increasing significantly over that time. And you can also see that GDP is off the charts, and those measures I've already talked about. But the other things we can look at, for example, are how many Earths would be required to sustain human consumption given the current population. And you can see that's been rising. So we need about 4 to 5 planets now to support human consumption. And one of the impacts we think of this marked consumption is on other species. So we know from population studies of aquatic and freshwater and terrestrial studies of other species, and there are many scientists around the world who contribute to this and published through something called the Living Planet Index. That index has shown massive declines in the populations of other species. And many biologists would argue that we're currently in the middle of the 6th great extinction event on the planet. At the same time, human beings have been doing much better. So as a species, and I would say sort of exerting our dominance, if you will, over other species, over time, our life expectancy has increased. We live 2 to 3 times longer than we did 100 years ago. And our infant mortality rates are way down. And both of these trends help to increase our population over time. And it's really interesting if you start looking at how much consumption occurs in different populations around the world. And granted, you know, countries are basically, you know, human constructs, geopolitical constructs, and I'm not going to go down the road of getting into why they are the way they were, but they are. But we know that more recently, a lot of these boundaries were created through colonial activities, and those colonial activities, what they did was they created inequities by taking resources from cultures that they tried to dominate, and also gerrymander boundaries so that they could continue doing that in the long term. However, if we break it down by the consumption by countries, we can see here that there are many countries sort of in the upper end here. To the right, Canada included, Japan, United States would be up there, a lot of industrialized nations who are consuming. Don't mind the scale on the x-axis there, but you can see it's in excess of 8, 9, 10, up to 12 hectares per person, per capita. And then in the middle, Cuba and so on, we're looking at about 4. And then there are many countries who are consuming a lot less. And so the question is, how much consumption do we need to achieve a healthy, on the y-axis, we have life expectancy. And how much consumption do we need to achieve a healthy life, right? How much stuff do we need? How much of the Earth's resources do we need to consume? Are some people over consuming? I would say yes. And some are also under consuming, right? So there's a broad inequity there across the world in terms of access to resources and how that affects health. And I think what we need to do is start learning from those countries that consume a lot less and try and figure out how that can be incorporated into our own lifestyles. So some issues for consideration from the Anthropocene are, we know there's a massive rate of biodiversity loss. So we have the diminishing resources problem. This biodiversity and biocapacity around the planet, we know it's not being shared equally amongst peoples. And so we have a rising inequality around the planet. And this loss is now going to threaten the capacity of future generations, right? Because, you know, is it fair that we consume so much now and that restricts the ability of future generations to be healthy and to succeed and develop in their own way? And finally, it's also a challenge for us to really consider how our consumptive lifestyles affect those in other parts of the world. So if you think about the technology even that we're using today, where are the resources mined, and where are these technologies put together? Who uses these technologies, and where does the waste go after we use them? Right. And a lot of the time, particularly in North America and in our culture, we rely on distant strangers. We rely on others around the world to produce things for us and deal with our waste. Is that fair? I'm not sure if that's fair. So moving on, I wanted to just talk about this notion of planetary health, which has sort of risen out of the sort of academic world over the last 5 or 10 years. And it's really it's more focused on human health and human civilization, the state and the sort of balance we need to create with natural systems. But essentially, what I would say, it's a reframing of the idea of sustainability and sustainable development with a health lens. So one of my favorite cartoons I like to refer to Gary Larson, because he always likes to do cartoons of other species. But I love this one where this bottle drops out of the sky with humans on the side of it. You see a bunch of humans running away, and you see this, hear this "uh-oh" from above, right? And Sir Robert Watson, who was the chair of the ISPPB or IPBES, and that's they look at biodiversity and ecosystem services, is really, the quote is that the health of ecosystems on which we and all other species depend is really deteriorating. And this ecosystems are really the foundations for our economies, right? For our livelihoods and quality of life and so on. So it's really an important subject to look at. So the concept itself is really the idea that we need to start thinking about how do we move away from growth, or economic growth specifically, as necessary for health. Do we have to have the type of economic growth we're talking about to have a healthy society? And can we turn our attention more to the extensive degradation of our planet that's associated with that kind of growth, but still advance human well-being? And so what we need to do is think about how do we reverse this trend by balancing what we think our needs are with the preservation of Earth's ecosystems. And then inevitably that hopefully will sustain the health and well-being of future generations as well. And this is going to require obviously multidisciplinary, interdisciplinary, cross-sector, transporter approaches to change mindsets and behaviors. That's kind of a point there, is like, yeah, it does. How does that work? Good question. So some people think it's kind of a different way to think about solving complex and interdependent global problems. I would say we've had this, it's not a new way, it's a repackaging of the way people have been thinking about it. Donella Meadows and others for several decades, but it's been reframed as a health issue with the Lancet and Rockefeller Foundation. Some of you, and most of you, have probably seen some figure like this, which is really looking at the safe operating space on the left-hand side, which tries to look at some of the inputs and outputs from our economy and into the natural environment, and some of the effects associated with that. So the green area in the middle is what they call the safe operating space. And then once you start moving out from that, we know we're pushing beyond the boundaries that are acceptable for maintaining healthy ecosystems. So, and one of the issues we have is we don't have a lot of data for these different areas that we're looking at. But where we do have data, like with biogeochemical flows and changes in land use and land systems and so on, creation of novel entities like toxins, radiation, and so on as well. And of course, climate change, we know we're pushing beyond the safe operating space.
Yes, as always, we have a little bit of a tech issue. So let's give a few minutes until Dr. Daniel comes back.
Did you guys hear that?
Yes.
Okay.
Do you need support with slides or anything then from our end? Would you like us to go through the slides so you can just speak?
No, I'm gonna share it again right now.
Sounds good.
I think that's where we were. Okay, hopefully, sorry about that. It's pretty wild. So it's -20 there, and it's +10 here, and gusting 90-kilometer-an-hour winds and lots of rain. Anyway, so where was I? Just gonna go back here. Yes. Okay, so I won't talk. I think most of you know about these things, and let's just say on the left-hand side, the orange bits of the part where we're pushing beyond the safe operating space. So I'm just going to dive right into the climate change and health issue. And when we talk about climate change, what we're really talking about here is long-term shifts in temperature and weather patterns. So although I could look outside and say, well, it's 10 degrees today, and I'm in the middle of, it's almost the end of January, or getting near the end of January. Yes, that's kind of odd for sure, but I'm not going to look out today and say that is climate change because I need to know how this has been changing over 30 to 40 years. However, in addition to those longer term shifts, we are also experiencing sort of more extreme events, right? So we have variations around those long term trends, and those are things we need to watch out for as well because they tend to be kind of extreme. And in terms of being extreme, we see these reports, report after report after report, to the point at which we kind of become numb to some of the messaging that comes out from the impacts of climate change. And it's a really difficult area, like a lot of the areas you work in, if you're concerned about the state of the environment and the future of the environment and the future of other species and so on. Sometimes it's really difficult to deal with a lot of this information and really figure out how can I as one person move forward and try and overcome some of these challenges that we have. Just some of the science, and I'm going to be brief here, but we do have from ice cores and other evidence, we have been able to look at difference in average temperatures over a long period of time on the planet, almost up to 1 million years from now. And if you take the archaeological evidence that states that human beings sort of evolved out of the rift in Africa somewhere between nobody totally knows, but I've seen estimates somewhere between 200 to 300,000 to 300,000 years ago. We can see that even since humans have been around, there's been these sort of massive fluctuations in temperature over time. And there's a really great story about how human beings almost didn't make it due to one of these events. But the difference between some of the changes that have been going on before and what's been going on now is that we think that we're actually inducing the changes. It's not a natural cycle. And so the predictions from the IPCC, based on a lot of the weather, a lot of the modeling done by physicists and others, really show more extreme changes in temperature, particularly in the extreme latitudes, and then also more extreme weather, precipitation events globally. So when we're talking about how climate change can affect health, we typically talk about indirect and direct impacts. So keep in mind that we're talking about temperature and precipitation. And so some direct effects of that, of course, would be like a storm I'm having now. So flooding, or if maybe there is no precipitation, we're going into a drought scenario. So food may be very difficult to grow, or may create heat wave events or other events like that that would have a direct effect on your health. And for those of you who've been in heat waves before, you know what I'm talking about. But you can also have indirect effects. And one of those, for example, is if I was to increase precipitation and even temperature to some degree, I may create conditions, for example, for other species like species of mosquito that carry diseases to flourish. And so what I'm doing is I'm creating the conditions for vector-borne disease to become more prolific, more pronounced, higher incidence of these diseases because of these changes in temperature and precipitation. And a lot of people are looking at what are the how do those impacts vary with vulnerability and the social dynamics in society, and how does that actually affect our health and our behaviors? And, there's lots of great literature out there that talk about all of these effects that you see on the table on the left-hand side. But I think one of the events that happened in Canada recently, and some of you may remember if you're out in the West, there was, and I don't think this affected Alberta as much as it did BC, but maybe correct me if I'm wrong, but they called it in 2021 this heat dome that was in BC. And some of the more recent epidemiological analyses show that almost 800 people died directly as a result of that excess heat that they experienced in British Columbia at that time. And this is really odd because I don't know if any of you have been to British Columbia, but it's not really known for its heat. It's quite a moderate climate. And so they sort of thought this is about a 1 in 1,000 year event. So we start thinking about what are the system level impacts from climate change. We can talk about how many disasters there are, how many people are affected, or the cost, but really where the risk occurs is when we have this combination of these hazards created by climate change that interact with the vulnerability and capacity of our cultures and of our social networks to respond to these physical hazards, and then also the extent to which certain populations are exposed. And that will determine what the risks are, or the risks we may experience from extreme weather conditions. And this includes aspects of our health systems, our healthcare systems. and their associated facilities, which can be affected by, impacts on patients and healthcare staff and supply chains and facility operations and other critical infrastructure associated with delivery of care. And so now there's more and more information necessary for people who work in the health sector to understand how these hazards are projected to change in the future and how this may affect different exposures of different people and their property and so on. And what are the vulnerabilities to healthcare infrastructure so that we can respond to and maintain health in our population. Now I'm just going to talk about sustainable health systems, which is really the topic. That's sort of the setup. And I'm just looking at my time here. I think we're doing okay. So when we talk about sustainable health systems, we're talking about a system that still can provide the care for those who need care today, but not compromising the ability to provide care for those who have needs in the future, which is really a takeoff, if you notice carefully, of the definition of sustainable development, but we're just going to insert health systems in its place there. And Canada starting to react to or taking more climate action, at least at the federal level. So most of you are probably aware of the Net Zero Emissions Accountability Act from November 2020. And the target within that act is to achieve net zero emissions by 2050. And it's really critical for the health sector to be involved in achieving these net zero emissions. And Canada also at COP26 was a signatory and signed on to commitments to build climate resilient, sustainable health systems as well. So there's some argument there that we can call the federal government to account to support that. Now, of course, most of you know, I hope you know, healthcare is actually delivered at the provincial level, and the federal money just transfers, federal government transfers funds from taxes and other sources to the provinces to deliver healthcare. So they don't necessarily have a say in how healthcare is delivered. They usually have a demand for certain kind of outcomes. But I think by incorporating it into this, we could start thinking about whether those transfers may be dependent on provinces actually committing to also reducing emissions and climate impacts associated with delivery of care. So if the global health sector, so if we think about all the healthcare delivered in the world, public health and healthcare delivered around, if the global healthcare sector were a country, it would be the 5th largest emitter of carbon dioxide on the planet. So healthcare is certainly part of the problem. And in Canada, we are the 3rd leading per capita emitter of carbon dioxide associated with delivery of our healthcare system. And it's not really, I don't like to be on the podium for that, but we're in 3rd place at the moment. And you can see, to some degree, how different countries, how their healthcare systems are organized, whether they're more social or not, how that relates to emissions. And you can see where the US is so extreme in terms of the amount of emissions that they have. And that's really because they have a more privatized system where access to healthcare is available to anybody who can afford it, and they have large insurance for that, and they over-deliver healthcare. And in reality, it doesn't really translate into better population health or better outcomes, even though that's what you hear in the news all the time. So healthcare, primum non nocere, nocere is the duty to do no harm. And so we have this paradox, right, where the healthcare sector contributes significantly to climate change. So the emissions in Canada are almost similar to the aviation sector in Canada. That's about where we're at. So what it means that if the sector does not introduce climate-friendly policies and practices, it paradoxically will continue to contribute directly and indirectly to the negative health impact. So on the one side, you have a system set up to benefit people and benefit their health, but that system is emitting carbon dioxide, which is making people unhealthy or will have health impacts. So we have a real duty here, I think, to cause no harm, which means to achieve net zero as fast as we can from the healthcare system. Some work done in the UK from the National Health Service was trying to estimate at a gross level what the carbon footprint is associated with different categories of care in the system. And you can see there that the direct care footprint on the left-hand side is really from some of the infrastructure, water, wastewater, from hospitals, and there's quite a bit from anesthetic gases So anesthetic gases, certain kinds of anesthetic gases are greenhouse causing, metered dose inhalers, and then all this business and travel associated with delivering care. But then we have the other side of this, patient travel and staff travel is a small portion of that. But the other side, the right-hand side of this wheel, if you will, quite a large contribution is the emissions associated with the development of medicines and different chemicals associated with the use of care. And then the whole supply chain, which is about 40+% of emissions associated with care in the creation and delivery of medical equipment and non-medical equipment. And then all of the other supply chain, linens, laundries, everything else associated with the delivery of care. So it's a start to try to identify hotspots in the system that we can start working on to reduce emissions from healthcare. So the principles of achieving sustainable health systems are, at least here are 4 that we can think about. And one is starting to empower patients and provide opportunities for self-care. So we really need people to stop thinking of the healthcare system as something they always need to turn to every time they don't feel well. Of course, I'm not saying that if, we have to judge the level of seriousness, but we also need for people to take on a bigger role in their lives and not just turn to healthcare every time they get a cough or every time something happens and start using emergency service and so on. The other thing we can start doing is we can making the service a little more lean, right? So we need to start being more efficient about delivering services where people need them, not everywhere, and streamlining care to minimize these sort of low value activities. We can start looking at what are low carbon alternatives. I'll give an example of how we're starting to use life cycle assessment to really think about, well, if we use this product versus this product, or can we reuse certain products? Is that better from a carbon emissions perspective than not reusing? And minimizing wasted care, right? Minimizing creating waste from delivering care that's not necessary. And there's a great organization called Choosing Wisely in Canada, which is really about making sure that you're choosing the right kind of care and not providing care when it's not needed. And most of all, and I can't stress this enough because I come from an institute working in population health, is we really need to start investing in children and the early years in our life and promoting and preventing disease early on in life so we don't need so much healthcare later in life. Right. So the more you invest in developing healthy young adults, so children through to adolescents, healthy young people who exercise, eat relatively well, and so on, the less demand there will be for healthcare in the future. And I'm sure most of you have been reading the headlines, and it's not just here in Nova Scotia, or maybe it's in your province as well, but there's been such a drastic increase in the demand for healthcare services that they're all overloaded all the time. So there's been some work done in identifying on the operations side and in other aspects of care, some strategies that can be used by those who are in administrative positions to really think about how to move towards a low carbon and resilient healthcare delivery system. And so we started up a project, a flagship project of the Healthy Populations Institute here in Nova Scotia. It was really funny because Dr. Sean Christie, he's a neurosurgeon, and he came to me one day and he said, I'm so tired of throwing out all of the stuff I don't use when I'm doing surgery. And he's just reached a point where he couldn't handle it anymore. He goes, we got to do something, but he didn't really know what we have to do. And that's expanded now into several projects that we're working on. And we've also brought in private life cycle assessment practitioners and other academics who work in that area to start to help us to start thinking about how do we analyze different aspects of healthcare delivery and how do we identify pathways towards reducing emissions from care. So we recently completed a review that was published looking at life cycle assessments within surgical and anesthetic care, because Sean's a neurosurgeon, so we started looking at surgical and anesthetic care. And apart surgical and anesthetic care, and then also things like hip replacements and knee replacements, they're probably procedures that are done the most and also would have the largest impact from the healthcare system. So we wanted to see, out of all of the studies that have been done, what are they working on? And are there any general trends that people have been noticing in terms of, for example, different products that people could be using that are lower, that have lower emission factors, for example, than other products? And could we make some recommendations around those? We're doing a life cycle assessment of cervical laminectomy and fusion. So this is a situation in your life where you have a lot of immobility and pain in your spine. And what Sean will do is he'll go in and he will take some lamina, some part of your vertebra or several vertebrae off and cut them open, exposing your spinal cord. And then we'll strengthen that area with some sort of stainless steel or titanium screws and some rails. And that will provide relief and pain. And this is probably does about 70 of these a year. And so what we're trying to do is not just assess, what is the life cycle assessment of one screw or one particular product that's used in the surgery. What we're trying to do is say, for this procedure, from the time at which the patient is referred to the neurosurgeon or referred to a specialist, that time up until the admission to hospital, during the procedure, and then during rehabilitation afterwards as well, what is the impact of that complete procedure? So that's something we're working on now. And then, of course, we're also trying to understand and survey the knowledge and attitudes of those who work in the system. So we've been doing some surveys with clinicians here locally and also across the country in neurosurgery. We've been doing some surveys with patients and most recently some interviews with decision makers who are in the health system, trying to get an idea of where they sit on the responsibility of the healthcare system for taking a leading role in advocating for sustainable healthcare. So this kind of reaching a concluding point here. I think to ensure sustainability and health, I don't think we would probably come to some agreement that, yes, wow, we figured out a way to be sustainable, but no one's happy or healthy. Well, that's not good either. That would be a really unfortunate outcome of a process to achieve sustainability. So I think most of us would agree that, to be sustainable, we also need to, have well-being and feel healthy and positive and so on. So we need to figure out ways to protect and preserve nature. And I think by preserving and protecting nature, that will also preserve the source of human health. And so, although we can invest in essential services, public services, and so on, I think we should be doing that a lot more and thinking about how to prevent people from entering the healthcare system. So how do we ensure that people have access to clean water, sanitation, clean energy, reducing exposure to air emissions in the air and water and so on? And how do we promote lifestyles early on in life that are more sustainable as well? For example, active transportation. If you can get people to be more physically active and so on, it's better for their body and not use a single occupant vehicle or a single vehicle, even if it has multiple occupants, but they're cycling, they're walking, they're taking the bus. It's a double bonus, right? Because now you're being healthy, but you're also not emitting as much carbon to the atmosphere. We need to really think about promoting healthy, sustainable food systems. And I think the guide that came out of the federal government is much improved over the last one, because it actually is focused more on grains and vegetables and so on, and reducing protein from animals, which is important. Sorry for those of you who may think otherwise. And we need to really start thinking about the cities that we live in. More than 82% of Canadians now live in urban areas. And we really think about how do we design our urban areas so that they can be more healthy and livable and so on, and not be so car dependent as we've built them right now. We also really need to start thinking about how do we stop when we pay taxes, how do we stop provincial and federal governments from directing that money to fund more pollution, right? So there are some critical roles for health professionals in all this. And one of the reasons why I think it's interesting working through health professionals to send this message about, the importance of climate change and reducing carbon emissions and associated environmental impacts is because they still are the most trusted profession in society. So when they do surveys of trust in different professions, healthcare professionals are routinely way up there, teachers and so on. And you can imagine where politicians sit on that scale. patient education efforts that include climate change impacts, right? So we want to educate patients about what climate change impacts might be and how they can avoid them and what role they can play in reducing emissions. We can try and understand more of the role of local and regional public health agencies and prevention and preparedness activities like flood preparation, heat waves, and so on, direct effects of climate change. We need to expand public and medical education, public health and medical education to address climate change. And we've been involved in looking at the curriculum refresh here at the medical school. And there's a lot of medical students now very interested in planetary health and how they can contribute, which is fantastic. And we really want to make recommendations for health improvements. So when people are consulted to write reports about how to fix the healthcare system, if they're not making recommendations that are ecologically desirable, then we have a real problem, and that recommendations are being made to improve healthcare that are not taking into consideration the impacts that care will have on the environment. I think healthcare professionals need to learn more about the relationships between human health and ecosystem health, right? So and particularly a lot of medical professionals that go through accredited schools, nurses, doctors, and so on, they're really focused on individuals and they're focused on people who require care, not necessarily prevention. And they're not totally educated very well on what are the sort of contextual characteristics of society or even the broader nature that we live in, and how is that all related together and how it impacts health. And if they do have some understanding, it's important for them to educate their peers as well as educate the public and work with community organizations that are actually trying to work as if we only have one planet, right? We don't have 4 or 5 planets. So we need to start working and supporting groups and organizations that actually acknowledge that there are limits to resources available for us to do what we want to do. Ensure the health authority that provides care for you has some kind of environmental sustainability committee or policy. So in Alberta, does Alberta Health have any policies, for example, looking at environmental sustainability as part of their healthcare delivery and management systems? And ask them if they understand what their impact is. Do they have an understanding of what their emissions are associated with the delivery of care or not? And if they don't, why don't they? And the other thing you can do is doing what you're doing right now, which is coming to these kinds of talks and learning more about the issue. And if anything, I'd be happy to engage or chat with you more about entrance points if you're interested in getting into this area. So getting involved, feel free to sign up to a mailing list we have through a national project called Cascades, which is really looking at how can we take evidence and create policy and education for people in the healthcare system and beyond. So you can contact Jillian. I'm sure she'd be happy to sign you up. We have mini courses on sustainable health systems with both sort of environmental scientists and healthcare practitioners and clinicians. Ask your health professional, what are they doing to reduce their carbon footprint? So it's, you go in to see your physician or your nurse practitioner or your other specialist professionals, and they're going to be asking you questions. But I think it's also okay for you to ask them, by the way, have that conversation about what they're doing individually to improve their environmental performance of their healthcare delivery. And then something we just created, the address is there, healthcarelca.com. We recently created an online database that's available of all of the available life cycle assessments that have been completed in healthcare, and have broken down all of the data from those, created plots and figures and tables and graphs, and it's interactive. So if you're interested to understand what the impacts are associated with different characteristics of healthcare delivery and the systems and procedures, that may be an interesting place for you to go and have a look at some point. I think these slides might be shared, so I've just put all the references that I used for the creation of the presentation onto one slide at the end. And I just want to thank you all very much for listening to me today and for your time.
Thank you so much for such an amazing session, Dr. Daniel. Your insights were really helpful. We are open for the Q&A right now. So if you have any questions, audience, you're welcome to put your questions in the chat, and we will go in order, getting those questions.
Did you want me to stop sharing the slides?
I think we can keep them on just for the end so that they can
Okay.
scan the QR code.
Sure.
Thank you. Well, we can start with one question that we have. You mentioned streamlining care to minimize low-value activities. What are certain ways that that particular thing can be done? Do you have any examples that you can provide?
Yeah, so we had a resident recently try and do a study on the use of imaging in Nova Scotia, particularly MRI imaging, and to go through all of the patient records to see how that form of imaging was recommended and for what particular issue was being identified, with the aim of trying to see whether or not there was sort of an over prescription or over recommendation for that particular type of imaging. And we found that out of 100% of the MRIs that were done, probably just over 40% of them actually didn't need to be done. So we have an issue in the system where we may not have the evidence available for practitioners and clinicians in the system to know whether or not they should be recommending certain procedures such as that. There's also a liability issue because some people feel that if they're not taking all the measures necessary that they need to take to ensure that they're providing good quality care, that they may get sued or that they may get in trouble for not doing as much as they could for the patient. And at the end of the day, there's going to have to be some kind of compromise realistically between, applying the sort of American model where you throw everything you have at it. And then you have to sort of have some compromise where you have to say, well, in this particular situation, as much as you may want this scan, we don't think it's recommended. And not only that, but it has major carbon emission, it has major impacts. So that's one example of becoming more efficient in the system in delivering healthcare.
Thank you so much for sharing that example. We have another question from Megan. She's asking what current med schools across Canada are offering in terms of courses on sustainable health systems for professionals entering the industry.
That's an excellent question, and I should know the answer, and I don't. So I don't know how many med schools are incorporating planetary health and climate change information and so on into the curriculum. I think that's starting to happen, and I've noticed that a lot of students who are pursuing medicine, at the sort of undergraduate, if you will, level, so they're undertaking their MD, are keenly interested in this area. So that number of students has been increasing. So I think there will be, and they're quite active, as you can imagine. So I think there will be a shift in that. The one I would refer you, that information may be available on a group that we work with called Cascades. And if you just type in Cascades, climate and healthcare or something into Google search, you'll come to their website, and our institute works with them, and they have funding from the Canadian Climate Change Action Fund over a 5-6 year period to really ramp up education and to influence policy in this area. So they would probably have a really good idea, I would think, about information to answer your question. Passing the buck.
Thank you so much, Dr. Daniel, and for sharing that resource. The next question
Great.
is just about the grade of extinctions. So in your presentation, you said that the Earth is in the 6th grade of extinction. How many grades of extinction are there in total?
Sorry, that might have been my mumbling. So what I said, but maybe didn't say clearly, is the 6th great extinction. Ecologists and biologists who study extinctions and archaeologists there have been some papers published over the last 5 to 15 years, maybe longer, that have looked at extinctions, large extinctions, extinction events, if you will, that have occurred on the planet over time. So most of you, obviously, you know, the most popular one, of course, is the extinction of the dinosaurs. But there have been many other extinction events that are of that scale or close to that scale. And so they call them great extinction events. And so the argument at the moment is that we are in the midst of a great extinction. And if that's true, then this would be the 6th one that has occurred on the planet. It's not easy to conceptualize or consider. I have a hard time dealing with that idea.
That is definitely a lot to reflect on and think about.
Yeah, that's right. Yeah, you have to, I mean, so like most of you, maybe who are interested in the environment, you know, I too, you know, one time went to school and then undergrad and studied environmental science and studies. And, you know, you can learn a lot about what's wrong and what's going on and the trends that aren't going in the right direction. And it's really easy to become overwhelmed and really easy to feel not great, feel almost not depressed, but don't feel very well about how we're doing as a species. And that's really difficult. And it's important to be with other people and to talk through these things together. And I think what the most important thing I can impart on you is to find something that you think you can do, that you can have an impact on, and just work at that as hard as you can and try and make as much change as you think you can make in whatever area it is. And if we all do that together, then we will achieve great things. But don't try and tackle the big problem by yourself. It's not a good idea.
Thank you, Dr. Daniel. Unfortunately, that's all the time we have for today. And thank you so much for answering all of those questions. And once
Pleasure.
again, thank you for your partnership with the Sustainability Council and ASLS. We truly appreciate all the time and energy that you have put into this presentation. I personally found the idea of sustainable health systems and the ideas you provided to sort of combat and move towards more so a sustainable healthcare system altogether very intriguing, and learned a lot. So thank you so much once again. Following the
Pleasure.
QR code, thank you so much. There is a QR code on the screen. Audience, feel free to find that link for the session completion form for the session in the chat box as well. Completing a form response will track your attendance to earn a certificate that helps ASLS improve the summit for future years. As well, it gives the audience an access to enter your name into the prize draw for this session. So please complete that form no later than 5 p.m. today to be entered for that prize. And to know more about Sustainability Council's events and opportunities, please feel free to browse our website and sign up for the newsletter. I will add the link in the chat right away. Thank you once again for being here with us today.
Thank you very much. And that is now lunch for ASL.